Hello, how you doing? I'm Dr. Henry. Can you hear and see me okay?
I can, thank you.
Excellent. Just to confirm, you are in a safe and private location, correct?
Yes.
Very good. And so we are going to be doing this visit via telemedicine. Are you familiar with telemedicine?
I am. I've been doing it on and off with myself and my kids since the pandemic.
Very good. And are you okay to consent to a telemedicine visit today?
I consent.
All right. Well, today I'm just going to ask you, so what brings you in?
Well, I like to run, but ever since I started kind of running again and running longer distances, I've noticed that I have some pain in my right knee, especially when I'm going up and down stairs. It doesn't hurt as much actually when I'm running. It's really kind of after I'm running and maybe especially when I'm trying to go up or down stairs.
Okay. Very good. Very good. And how long ago did you start feeling these symptoms?
Probably about a month ago or so. It started to ache a little bit when I was on the stairs.
All right, well, I guess today we'll be examining your knee. And which knee is it?
It's my right knee.
The right knee.
Yeah.
All right, are you able to bring your camera to a place where I can see your right knee clearly?
Sure.
And I'm going to do the same.
Okay. I'm going to try to maybe position it on the floor, do you think? Would that be?
Sounds good.
Okay. There you go. Can you see me okay?
I do see you okay.
Okay.
All right, well, first things first. If you had to point to the pain, where would you point?
Here, do you want me to put my pant leg up a little bit?
Oh, yes, please.
Okay. Okay. So it hurts kind of like right on the top of like right there. Like I don't know if you can see that okay.
Right there, okay.
But it's like right kind of in the lower part of the kneecap there.
Okay, very good.
Okay.
And I'm going to ask you to press a few areas. If you want to sit down right now, you can sit down for this part of the visit.
Okay, I'll pull a chair over.
Okay.
All right. Can you see okay?
I do.
Okay,
I do.
Perfect.
So I'm going to press a few areas. I'm going to ask you to press these areas. You let me know if there's pain when you press down on these areas, okay?
Yep.
So first, the inner part of the knee. Can you press over here?
Kind of toward the inside?
Exactly.
Yeah, that kind of is where it hurts quite a bit. It's more toward that inside of the knee, kind of right where you are.
All right. Now press on the side.
On the inside?
On the inside.
Kind of where the joint is there?
Exactly.
Yeah. Nope, that doesn't hurt really.
All right. Now we're going to go on the other side and press on the front outside.
Front outside. A little bit there. Yeah, a little bit.
And now press on the opposite outside.
Right. No, that doesn't hurt.
Where the joint is. Okay, very good.
Okay.
Now, I'm going to ask you to press on something called the patella tendon, and so that's right below the kneecap.
Uh-huh.
Any tenderness when you press in that area?
That's where it's a little bit uncomfortable, kind of more toward like right here where I'm pushing. A little bit lower down on the knee.
Okay. And now, I'm going to ask you to straighten the knee out a little bit.
Okay.
And press directly on that kneecap.
Okay.
Any tenderness or discomfort there?
A little bit, yeah. A little bit.
All right, very good. All right, so, and when you're looking at the knee, do you see any kind of redness, any swelling? Any deformities? No,
and I don't remember injuring it in any way. I don't see anything like that on the front or really the back.
Very good.
Okay.
All right, well, let's go on and look at some range of motion.
Okay.
So I'm going to ask you to straighten the knee out all the way.
Okay.
And you should be able to make it completely straight. Are you able to do that? I'm not sure if you can see it clearly from me.
Yeah, I can straighten my leg.
Very good. And now, see how far you can bend it.
Okay.
Are you able to bend it pretty well? And go on and move to the side a little bit so I can see how much you can bend it.
Kind of really pretty good, I think, or maybe.
Okay. Now move to the other side so I can see the injured area.
Ouch.
There we go.
Okay. And then, yeah, I can bend it up.
Very good.
Okay.
All right. And so now I'm going to just ask you to stand up.
Okay.
And let me just see you walk so I can see if you're able to walk normally or if you have to limp or anything.
Okay, let me move the chair.
Okay, very good. So that's a normal walk. Now let me see you walk on your toes.
Got my toes. Okay.
Any issues with that?
Nope.
Let me see you walk on your heels.
Okay.
Any issues with that?
No.
All right, very good. All right, so now with this might be a little tricky because I'm going to ask you if you're able to sit on the floor.
Okay.
We're going to check a few things out, okay?
Okay.
And I'm going to ask you to face sideways
Okay.
with the injured side facing the camera.
Gotcha. Okay.
All right, first things first. First thing is first, I want your knee, so you'll be sitting on the ground,
Okay.
and your knee will be at about 45 degrees.
Okay. Got it.
Now, this is a variation of a test called the anterior drawer test.
Okay.
Okay? What you're going to look for is if your knee, if you see extra laxity in your knee when you push the knee in or when you push the knee out. Okay? So first things first, we're going to push from our calf muscle. We're going to try and push the knee forward.
Okay.
So, and you're going to try and keep the foot stationary on the ground.
Okay.
So when you do that, do you notice any kind of laxity with the knee moving forward?
Not at all.
All right, and now we're going to do the other way. So our hand is going to be on the outside of the knee. We're going to try and bring it in. Again, the foot is going to be stationary on the ground.
Yep.
Any laxity with that?
Nope. Stable.
All right. Very good. Now, with that being said, since you're already in that position, we're going to test two ligaments.
Okay.
So again, this is a variation of testing the LCL, which is the ligament on the outside.
Okay.
So since you're already on the ground, what you're going to do is you're going to tilt your knee outwards.
Okay.
Exactly. And you're going to put pressure on the inner part of the knee.
Okay.
And so going to put some pressure on that, and tell me if you feel any pain on the outside of the knee.
Not at all.
Very good.
Okay.
Now we're going to do the exact opposite to test
Okay.
our MCL, which is the ligament on the inner part of the knee. So we're going to bring that knee inward
Okay.
and put pressure on the outside of the knee.
Yep.
Any
Feels
pain
fine.
with that?
Nope.
Very good. So that was the variation of the valgus stress test.
Okay.
All right. Now, since you're already down on the ground, we're going to straighten the knee up again.
Okay.
And again, push down on that kneecap.
Okay.
And so that's called the patella grind test. Tell me if you feel any pain with that.
Yes, that hurts a little bit.
Okay. And that kind of goes along with the running pain that you were talking about.
Okay.
This next test, again, with the knee straightened on the ground, you're just going to move that kneecap back and forth, side to side.
Okay.
Any discomfort with that?
It's hard for me to do. Here, let me try again.
And so to do this test, you have to
gotta
kind of relax the
Yeah,
knee.
you have to relax.
Mm-hmm.
No, that feels pretty good.
Very good. So
Yeah.
that's called the patella apprehension test.
Okay. That's okay.
All right, and the last test that we'll do is called the Thessaly test. That's going to test your meniscus. For this, you're going to have to stand up.
Okay. Got it?
With this test, what you're going to do is you're going to bend the knee a little bit, the
Okay.
injured knee, and you're going to raise the other leg up,
Okay.
and you're just going to twist back and forth. Any pain with that?
No.
Very good. So that tests the meniscus, and that's called the Thessaly test.
Okay.
All right, so we can go in and bring the phone face to face again.
Okay. Perfect.
So you did very well with that knee exam.
Thank you.
From that, it definitely looks like you have something called patellofemoral syndrome,
Okay.
which is basically a weakness of the stabilizers of the knee. The best way to deal with this issue is by strengthening your quadriceps, strengthening your core, and strengthening the hamstring.
Okay.
And so I think what we'll do is start off with some physical therapy so they can come up with a program for you to do that. And then also they'll instruct you as far as your home exercise program so you can continue those exercises.
Okay.
If you need something for pain, you can take some anti-inflammatories. So that can be ibuprofen or naproxen.
Okay.
If the pain is more severe, where that medicine is not taking care of those issues, give me a call and I can send something to the pharmacy.
Okay. Perfect.
I think we'll reconvene in 6 weeks so we can discuss your progress. But if you have any questions, please feel free to call us.
Okay. Should I stop running?
I would say stop jogging and
Okay.
running right now.
Okay.
If you want to do some things, you can always cross-train, so you
Okay.
can use the bike. The bike is really good for these type of issues.
Perfect.
All righty?
That's great.
All right, my office will be giving you a phone call to go in and set those things up that we talked about. And you have a good rest of the day.
Thank you so much.
My pleasure. You take care.
Bye-bye.